presenter, and that's Tiffany Boughtwood. Now, you've seen Tiffany's bio. That's been out there, and a little bit of an abstract, but you know, Tiff's been involved in genomics from the in Australia for quite a while. But she also recognises that we need to do more to engage with Aboriginal and Torres Strait Islander people in this genomic space, and it's not only in the clinical workforce approach, but into the research and how do we get the engaged. So Tiff will be presenting on emerging genomic translation activity in Australia and the opportunities and implications for Aboriginal and Torres Strait Islander peoples, with a reflection on the global, on what collaborations are about the genomics reference databases and where we're on, and genetic variations and some of the issues around that and why it's important, and also about the, you know, how we might leverage into the Genomics Health Futures mission that Australia is keen to progress, and there is a little bit of money in that space. But anyhow, I won't go on any further, but I would like to invite Tiffany now to open up with your presentation. Thanks, Tiff.
Thank you so much to Tom and the Poche Centre for the opportunity to contribute to today's discussion. Initially, I'd like to acknowledge that I'm dialing in from Boomerang country, the Kulin Nation people from Bayside, Melbourne, and extend my respect to their elders, past and present, and emerging leaders. So as first speaker today, and recognising that we've got people joining us from lots of different backgrounds, I thought initially I'd give a quick 101 on some of the terminology and the technology that we're going to be addressing today. And first, a shout out to the beautiful still that I grabbed from the Your Blood, Your Story animation that Greg will be speaking to later on. So, the cells of every plant and animal contain genes, and genes are like the instruction manual that helps your body know how to grow and survive. Genes are made up from sections of DNA, which are molecules that are made up of 4 bases that we nickname A, C, T, and G. And it is the sequence of those 4 bases that encodes and gives the instructions for how cells, and importantly when cells, are to make specific proteins, the building blocks of the body. So genetics is about how traits like how you look or how you laugh is passed down from generation to generation, and you inherit half your genes from your mum and half from your dad. All humans are very genetically similar in terms of just sort of the amount of similarity of DNA sequence we have, but it's that 0.1% difference that makes you unique. So changes arise in DNA all the time, either inherited from your parents, acquired from environmental effects like cigarette smoke or UV light, or just arising when the DNA is replicated in the cell. Sometimes these variants can lead to changes in how a protein functions, and that can lead to illness. And the focus of today's discussion is around genomics, a technology we use to help identify and to manage genetic illness. So governments and scientists and clinicians and geeks like me have all very excited about genomics from the potential it has to revolutionise healthcare, as Tom alluded to. And the reason we believe it has this potential is that it doesn't only impact diagnosis, but genomics can be used across the whole gamut of health intervention for genetic disease. And this brings about not only benefit just for the individual patient and the patient's families, but the health system overall and economic benefit of the nation. And this sort of collective benefit and potential is why governments around the world have invested heavily in genomic initiatives to explore how best to apply genomics for the benefit of their health systems. The Global Alliance for Genomics and Health is an international collaborative that brings together these genomic initiatives, both sort of governments, large organisations, academic and industry, to share how different nations are applying genomics and really try and unite efforts around, and sort of standardised efforts, I guess, around how genomics is applied. And Australian Genomics, which I manage, is a driver project of the GA4GH. Excuse the crow in the background, sorry, the delights of working from home. So the GA4GH does this by developing technical standards around how DNA is how data is captured, how it's stored, how it's shared. It develops sort of policies and frameworks around consent and sort of the regulatory and ethical issues, and also shares approaches to equity, diversity and inclusion across the different member organisations. There are also some very successful Indigenous genomic collaborations internationally that are developing policy frameworks and standards to guide both research and clinical activities involving Indigenous peoples. So there's a number of Indigenous data sovereignty collectives, including Australia's Mayam Nagri Wingara Indigenous Data Collective, that's actually presenting this morning to the ORCID collaboration. There's the Global Indigenous Data Alliance, GIDA, and they work and advocate to promote for the care principles around genomic data management. There's a number of Indigenous-led biorepositories and data repositories that are being established, and we're certainly going to hear further from Simon about the National Centre for Indigenous Genomics and their efforts. The Hawk data system is actually a really interesting one that's been established for the First Nations peoples of Canada. And it's an online web platform that allows Indigenous communities not only to shape research priorities that are aligned with community interests, but also to engage with external researchers, define the terms of access to data, and also to ensure shared benefit coming back to the communities. The Summer Internship for Indigenous Peoples and Genomics, the SING Consortium, has sort of units, I guess, or consortia that's from the US, Canada, New Zealand and Australia. And that really works to develop workforce capacity from Indigenous peoples, as well as sort of education and advancement around genomics. And there are a number of leading Indigenous-led genomic initiatives, and we'll hear further from Greg and Alex and Simon on preeminent examples from Australia later this morning. So we have a huge volume of data on human genetic variation across the population. And that's thanks to genome and exome sequencing of millions of people. However, diversity in genomics is a very big problem, as Tom indicated. The genomic reference databases currently in existence are dominated by people of European descent, and there's a near complete absence of populations from key Australian groups, including Aboriginal and Torres Strait Islander peoples. There's also an underrepresentation of people from this region, the Pacific region in Southeast Asia. So the implications of this lack of good data on these populations means that we have less of an understanding of the natural variation that arises in these populations, which impacts both the design and the application of genomic technologies for these people. Just a quick shout out there to the Centre of Population Genomics, and I know some members of the CPG are joining us this morning. So Daniel MacArthur, who was very much involved in establishing the gnomAD database that Tom referred to, and is a bit of a superstar in genomics, he's returned to Australia to set up the Centre for Population Genomics across the Garvan Institute and the Murdoch Children's Research Institute. And the aim of the Centre for Population Genomics is to correct these population inequities, I guess, in the databases by enriching the reference databases for Australian population groups, including Aboriginal and Torres Strait Islander peoples. All right, so moving on to other national genomic activity currently underway. So many of you would be familiar with the Medical Research Futures Fund and the Genomic Health Futures Mission that's been established through the MRFF. This sort of, grant opportunity, I guess, will be investing $500 million over 10 years to focus on genomic research. And rather than just focusing on the diagnostic aspects of genomic applications, it's really keen to explore new areas around screening and therapies. So the projects funded to date include genomic research into cancer, diseases with poor prognosis, the application of genomics in an acute care setting, the ethical, legal and social implications of genomics, and pathogen genomics, as well as reproductive carrier screening with Mackenzie's mission. And to the right of the screen, you can see Rachel and Johnny Casella with their daughter Mackenzie, who died of SMA, which is a severe pediatric genetic disorder. So as Tom mentioned, I manage the Australian Genomic Health Alliance, which was established in 2016 with federally funded grant from the NHMRC. And the work of Australian Genomics has really been to explore how genomic technologies can be embedded in the Australian health system. And we have been working on that by evaluating the various elements of health economics, clinical benefit, management of data, policy implications, and driving these sort of research activities by enrolling Australians into rare disease and cancer clinical projects that we call flagships. We're very much a national research program, so we've been enrolling participants into our flagships from every state and territory. And we have hundreds of collaborators from sort of the clinical aspects, genomic research, patient support and advocacy groups, and sort of the whole sort of rich tapestry of who has to be involved in genomics to really see that embedded sustainably in healthcare. So to date, we've recruited about 4,500 people into our clinical flagship projects, and they're listed down on the left of the screen there. And despite the challenges of COVID this year, we're pleased to have reached 90% of our target recruitment for the first 5 years of Australian Genomics. So the programs that have been intersecting with those clinical flagship projects explore themes around workforce and education, around data capture, data management and data sharing, the evaluation through implementation science approaches, policy, ethical and legal analysis, and also, and very importantly, establishing that diagnostic and research network, because it's well known and well established that particularly with genomic medicine, a good intersection between clinical activity and research activity is very important to enable that sort of virtuous cycle of acquiring knowledge and applying that knowledge in healthcare. So this is just popping up some of the highlights from our activity of late. So we've approached and explored various methodologies associated with consent, including a dynamic consent platform to support participants in genomic research. We applied to the Medicare Services Advisory Scheme to get childhood syndromes and intellectual disability testing with genomics through the MBS. We've been developing a network to expand functional genomics capacity in Australia. And, you know, as mentioned, have developed a range of tools for data analysis and capture. So that's sort of recent highlights. Looking forward to the next phase of Australian genomics, we're really focusing on the intersections between the research environment, clinical delivery, policy and data management, and very importantly, the involvement of the public, Indigenous people, patients, advocates, as well as policymakers and international consortia in how to enrich Australian genomic activity, and also to ensure that applications and work in Australia has international impact. But more broadly, looking forward, I guess, aspirationally to genomics in Australia, I think we really have to have a collective effort to ensure that the genomics of the future be a genomics for all, with equitable representation in research, equitable access to the benefits of research, which in fact was stipulated in the Universal Declaration of Human Rights back in 1948, that it's a foundational human right for all people to benefit from science and its application. Only then will we see more equitable outcomes from genomic medicine. But in order to achieve that equity, we really need to ensure that ethnically diverse populations, Aboriginal and Torres Strait Islander involvement in genomic research is enriched. We need more diverse reference genome data sets. We need to train diverse community of genomic research scientists and look at better means for identifying clinical presentation of genetic illness, as well as genetic risk across ethnically diverse populations. And in order to do that, we have to work with Aboriginal and Torres Strait Islander people and other underrepresented communities and earn that trust. Thank you.